who is also the chairperson of the National Tobacco Control Committee, and Commissioner Pa Bojang, who is the team leader for the NCD unit, all the media house present here today. We are so grateful, and we welcome all of you to this short quarterly briefing. Every 3 months, we do have this quarterly briefing to share some of the development that we have on tobacco control. We have series of activities sponsored by Management Health Sciences. It's a 1-year project, and I think this is the second phase. Last year, we had a similar one. It phases out, and this year too, we were lucky to have another phase, and this is what we are implementing. And after the implementation of each milestone, we do have a briefing with you people to ensure that whatever we are doing in the community reaches the people. And this is why we are here today, and we are so grateful. Anytime we call upon you, you are more than willing to respond to our requests. Even though how short it might be, you are always willing, because this information was passed, I think, day before yesterday, and it's supposed to be yesterday, but unfortunately we were so busy, and we have to reschedule it to today, and you are here with us. So that shows the commitment and the zeal you have to partner with us in the tobacco control. And we all know tobacco control is not an easy task, and it's not the responsibility of a single entity. It is the responsibility of all the stakeholders, including the media. So this is why we are here today, to at least come together again as a family and share the information of what we are doing for the past 3 months. And this will continue after this session. Milestone. There will be another milestone that we will be doing again, and when it finishes, we will call on you people again to brief you what we have done so far. So I don't want to waste more time, because we are a little bit behind the schedule, and we have other commitments to do. So there will be various speakers that will give you a brief of what has happened, and the director is here who will also give the opening statement so that we can get into the discussion proper. So I welcome all of you for taking time to come and attend this media briefing, so that the community can know exactly what we are doing on tobacco control in this country. I thank you all for your coming, and looking forward to fruitful partnership that we already built. Thank you very much for your kind attention.
We start by honoring and acknowledging the presence of the program manager, NCD, Commissioner Pa Bojang, the team lead for the monitoring team, staffs of the NCD, and of course, in welcoming you to this quarterly briefing. I think this is a very effective way of continuing our efforts in controlling the use of tobacco. And the media, you are not just partners, you are part of us. And it's good that from time to time we update the public. And the only way we can update the public on our interventions is coming together, calling you and give you the update, which we believe when you are given, it will reach the public. We know, and this is another way also that we can remind the public on the danger on tobacco use, and also what we collectively need to do to control the use of tobacco use. I know it's a very difficult task, but it's always easy when we put our hands on deck and work collectively, because this exercise needs a collective effort, and it needs all roles to be played by everybody in the country here. When you look at the effect of tobacco and the lives that we lost, especially those that are very innocent, who are non-smokers, but they are still affected. That shows out that even ourselves, we are not safe. So we have to come up strongly to implement all the interventions that we've put in place, so that we will have a free tobacco country. I know it's not easy, and the implementation of the policies and the acts also can only be strengthened by communicating to the public, because the public need to know, and they need to be reminded of what they really need to know, so that they understand all our interventions in their own context, to be able to adhere to it and be convinced, so that they will be able to adopt positive behavior. I think with this practice, we'll be able to encourage those who are not directly implementing the interventions to be part of us, so that we will be able to achieve our objectives. And I will congratulate and thank all of you for showing up your commitments. Anytime we call you, you see yourselves as a part of us. And also the general public, I know we're doing a lot, and the program itself, and especially the Tobacco Control Committee, supporting the program in implementing our efforts. I'll need to encourage everybody, the public, to listen and also see the updates that we are giving them, so that they are reminded and adopt to positive behavior. I think a lot of it will be shown during the presentations, and that will really help us to know what level we are. And the presentations also that will be made here also will help us know what level we are, and the gap, what do we need to do, and show that we achieve our objective. I know the country is doing a lot, but we still need a lot to do. With these remarks, I thank all of you for your commitment, and always being ready to take part, to be part of us in the implementation of all these interventions. With these remarks, I want to take, on behalf of the Ministry and the Tobacco Control Committee, I want to take this time to declare this press briefing open. Thank you very much.
Welcoming you back to the same place, because we are family. I think this is not the first time we have met, either in the field or on press briefing like today. There was an activities which some of you were involved, either your institution or individually. Actually, we achieved a lot, but still we have gaps. And we believe those gaps should be done collectively. Today, individual sticks or single sticks are under control. At least we have improved on those things. But still we have gaps, particularly in the Greater Banjul area. In the provinces, compliances, almost, thank God, they have understood and they have acknowledged the task force, that is the Tobacco Committee, their responsibilities. We can't make it as a TCC individually. It's the media and the community that can support us. This tobacco is a problem and is a catalyst to all crime and criminal or medical NCD problem in this country. The burden on medical and health, the burden on crime rate is all started from tobacco. I think this shisha you are seeing, this variety type of shisha you are seeing here, now what are they doing? They are not using it even at the recreational centers, but even at our homes. We cannot be everywhere. The media should support us by sharing this information, engaging the community we came from. That will at least show another positive impact on this thing. As the director have already said, we will do something. But to filter the information, at least there must be a community commitment. The society have to be part of the enforcement. Yeah, sometimes people believe enforcement is about arresting, detaining, or putting them on custody. Enforcement started from advocacy. Communicate to them, let them understand about the laws and the negative impact of what they are doing. Those are all part of, we call them confidence building. If you engage the community for them to understand their rights, is part of enforcement. I think that's why you people are here. We may arrange or we may design certain means of communication, but by using or going through you, it will be very easy for them to understand what is our intention. Our quarterly operations this year, one can say, is positive. But the gaps remain, as my director says. It can only be complemented and we can achieve our goals when we see ourselves together. And I think I make it so precise for this point. Thank you very much.
Manager non-communicable diseases. Commissioner Pa Bojang, who is the team lead for tobacco industry monitoring and interference, the tobacco industry monitoring team. My colleague, our Sanyang, and Director of Health Promotion, who also doubles as the Chair of the Tobacco Control Committee, the media personnel here present. We thank all of you for joining us today on this very important briefing on the activities regarding tobacco control in this country. The Non-Communicable Diseases Unit, which also houses the Tobacco Control Program, has a project on tobacco control from the Management Sciences for Health. This project supports awareness and enforcement activities on tobacco control, law, and also behavior change aspect for those that are using this product. And since the beginning of the project, a series of activities have been conducted that are targeting community structures and also enforcement activities. And the project has its interest areas. And one of those interest areas is enforcement of the provisions of the Tobacco Control Act. One is the graphic health warnings. That is, if you notice, since 2021, the Gambia has introduced pictures on cigarette packs. And this cycle is going to phase out this September 31st. It is September 30th. It is going to end, and a new cycle will begin October 1st. A new set of pictures, which I will display later on. And the project is supporting that to make sure all tobacco products that are intended for this country have those graphic pictures to ensure that there is no illicit cigarettes in the country, and also to ensure that those that are dealing in tobacco products conform with this regulation. So we conducted an enforcement operation enforcing that provision in this milestone. In terms of community activities, we also conducted an orientation with district or in all the regions with religious leaders and influential leaders in our community. That is the Christian Council and the Muslim Council across. So in each region, we oriented about 210 across the 7 health regions, that is Western 1, Brikama, LRR, CRR, North Bank, that is North Bank East and West, Farafenni and SL, and also Basse. So altogether, 210 religious leaders, that is from the Christian Council and the Muslim community, were oriented on tobacco control. That is how they can play a part in ensuring that tobacco use is very minimal, if not eliminated, but very minimal, and also the compliance on the provisions of the Tobacco Control Act are also adhered to. Because the ministry realized that enforcement alone will be very difficult to achieve our objectives. So we have to use our influential leaders, our religious leaders, that when they talk, people will listen. When they call, people answer to their calls. So we use those people in our fight so that they will use this message in their sermons in the social gatherings and whatever events they attend to also discuss the impact of tobacco use on health, on the economy, on the environment, and how it also relates with their religion. This is why we also brought those people on board. We also have a meeting, an orientation session with school health clubs to get them, the intention is to get to children at a very young age so that they will know about these dangers to tobacco use and they will go and preach it in their homes, in their schools, in their playgrounds, and they will not indulge into the activity. We want to get them young so that they will know dangers associated to it and they will not use it. This group too, around the country, representatives from different schools were there, and about 210 members from the health clubs in the country were represented, were oriented on the tobacco control activities. We also have another orientation with community leaders. This is the village heads and ward councillors. These were also oriented, all on the same thing, to have a multi-sectoral approach as far as tobacco control is concerned. We also have an orientation at the central level with representatives from relevant ministries, authorities, and relevant stakeholders around the country. All the ministries in the country and some relevant authorities were also invited for an orientation for their stand. What is their responsibility as far as enforcement of the Tobacco Control Act is concerned? Because there is a provision in the Act that discusses that protecting public health policies from the vested interests of the tobacco industry. And all public offices have a role to play in that. So they were also oriented as far as that is concerned, so that they will protect the public health laws from the interests of the tobacco industry, and also make sure that the Tobacco Control Act is enforced at these places of work or these public places. We also had another orientation with transport unions, that is garages and market committees, LUMO committees. We have this orientation session with them, shopkeepers associations. We have this orientation with them across the country also, because the markets and LUMOs and the shopkeepers, these are the people that are dealing directly with these tobacco products. They are the ones that are selling. Buying and selling happens at these places. So they have a key role to play as far as enforcement of the Tobacco Control Act is concerned. You can see there is a park that is open. These were confiscated during the last enforcement operation, and this is done by shopkeepers at the markets and at the LUMOs. This is why they have a key role to play, and we feel it is important to also orient these people and inform them of their responsibilities in the Act, what they should ensure. Because one thing people need to understand, the Act does not ban tobacco selling and usage in this country, but it regulates its selling and usage. It does not stop anybody, any shopkeeper, from selling tobacco products, but there are provisions or regulations you need to follow. One is that you can't display tobacco products at point of sales. Who are these people that are displaying tobacco product at point of? These are shopkeepers in our markets and in the LUMOs and in our communities, in our corner shops. So if we leave them behind without telling them what they're supposed to do, it will be difficult to achieve our objectives. This is why we invited them for a meeting regionally to tell them this is their rule, that they're supposed not to display tobacco product at point of sales, and when they are selling, they should not open the pack and be selling in single sticks. Tobacco should be sold in packets of 20, not even 10, but packets of 20. And they are not to sell any tobacco product that do not have any graphic pictures on them. That is, there is a picture in front that has this picture of a baby with tubes in the mouth. This is the current picture. Any tobacco product that do not have those products cannot be sold in this country. And this is an example of one of those products. It is a tobacco product, it is a Caesar product, Caesar flavor, but it is a tobacco product. But this is not banned, but it do not have any graphics on it. This is why it was confiscated. And also, the use of electronic cigarette vapes is banned. Any electronic nicotine delivery system in this country, its possession, distribution, importation is banned in this country. So those products there are also confiscated from shops, from supermarkets, mini markets, because they do not conform with these regulations. So shopkeepers cannot be left behind. This is why we also inform them so that they know what they should sell, what they should not sell, what they are supposed to do as far as tobacco control is concerned. These are the quarterly media briefing we are doing is also part of the activities for this current milestone. We do this quarterly to brief the media of what is happening as far as tobacco control is concerned, so that the public will be informed of our activities as far as the enforcement of the Tobacco Control Act is concerned. So this is what we have for you as far as this milestone is concerned. Thank you for your kind attention.
Thank you so much, Mr. Sefu Singate, for that rundown of activities.
We begin with what the gentleman was asking, whether we planning for the total ban of the tobacco products in the country. Yeah, this would be our wish, but unfortunately it's completely beyond us. And that is also beyond the Ministry of Health, because each ministry has its own responsibility. The importation of tobacco product, it has some legalities and regulations which is completely beyond even the country. Regional agreements are there, the protocols that need to be followed. So the Gambia cannot just violate those ones just like that. And our mandate as the Ministry of Health is to regulate tobacco products in line with what the health is looking for. And this is what we have, and this is what we are also doing. So going beyond that might not be very good, pleasing to the Minister of Health, because we are going outside our jurisdiction. So this is why we are only limiting to the regulation of tobacco products with regards to tobacco control laws that we have, Tobacco Control Act 2016 and the Regulation 2016. But the total ban and the condemnation, maybe that will be a mandate of another ministry, maybe Minister of Trade, including GRA, Minister of Finance, which might be very, very difficult per se. Coming to the status of those who violated the Tobacco Control Act and the regulation. Yes, there are a series of violations going on. This is not the first time, and we've been conducting these quarterly. And we see a lot of tobacco products that doesn't conform with the rules and regulation of this country in accordance with what we have. And what we do is we confiscate those materials, and there are processes that we also have to take. It's not just like we just condemn these and go and destroy or take those people to court. Of course, illegal action should be taken, but these need some processes, and these are the processes that we are following up, and all these materials will follow all those due processes to ensure that those culprits, those found wanting, are taken to court and the legal actions are taken. So we are on that move right now. It is a process, and it's just not going to happen just like that. So we are just following those due processes. With regards to the comparison regarding the seizure of this product compared with the one that has been confiscated previously, I think we are seeing an increase, especially on electronic cigarettes. All these products you see, some of them did not have graphic design and health messages, and some of them are just electronic cigarettes without because electronic cigarettes in the country is completely banned. It's different from the shisha. Shisha, the importation of shisha is not banned, but it should be in line with the tobacco control regulation. But any form of tobacco, electronic cigarette, be it electronic nicotine delivery system or electronic non-delivery system, should be completely banned. All form of that should be banned. And now we are seeing a lot of these coming into the country, and most of these products are targeting the youths. And they are designed in such a way, it has different flavors which are so attractive. And they are in different forms. Some are in form of a pen, some are in a form of a flash drive, some are in a form of something that will just attract especially the youth folk and the women in general, because these are the people that are targeted for these products, and these are the people that are targeted for advertisement of these products. So they make sure it's designed such a way that it will attract the young ones, and we are seeing those ones in the country, a large number of those ones in the country. And what makes it difficult, because this is not only the lot of it, what makes it difficult, whenever we start this exercise, before we know there are, because now this social media is also disseminating information very quickly. So because of these, whenever we are out to do this exercise, you see them calling one another. Before we arrive, everything will be sorted out. But do we have large chunk of these materials, unwanted material or material that are not in conformity with the rules and the regulation of these according to the tobacco code? We have a lot of them. So we're going to seize all this, and we take right procedures in making sure that those people are taken to court, and whatever cost it is, especially if it is a large chunk, it will be going to be bought by those people that have these materials, and all the cost for the confiscation and other things will be the responsibility of, according to the Tobacco Control Act and the regulation. But we need your support, because we cannot do it alone. We need your support. Looking at those that are responsible for enforcement of this Tobacco Control Act in this country, they are very thin on the ground. Public health officers, the environmental health officers, or the environmentalists, that is the NEA, custom officers, and the police. But if you look at these products, they are everywhere. From Koina to Carton, they are everywhere. Before, the concentration of all these products are in the Greater Banjul area. But you'll be surprised to go to the up countries and find all these products there. And most of these other products that are not electronic cigarettes, that are just this mere cigarette, you see a lot of them in around Basse and the others that doesn't have these graphic health warning. Because of the porous border, those products come illegally to the country, meaning they come into the country without being taxed. So meaning the government will lose a lot of revenue on this cigarette, and the access of this cigarette will be very accessible to the people, the community over there. And looking at the comparison between these two products, those that have legal mandate to be in the country and those that are not legally mandated to be in the country, illicit trade products, most of the time they are cheaper, because they come through struggle, illegal means. And most of these are products that are very cheap, and they will sell it out to people at a cheaper rate, so that it can be fast going, and that they can have other products to come, because they are smuggling. And anyone who is doing that act, we all know that is doing it through having means of gaining wealth through quick ways. So these are some of the problems that we are facing. And you being the media people, you are always out in the community individually or during your work. We need your support to ensure that these people are exposed, and you can also contact us. We have the numbers of the team leader, we have the numbers of our office, and any health personnel that we've seen can be reported. Though in the country, Muslaha syndrome is also affecting us. You know, you are close to me, I'm also close to you, and you know my brother, you know my sister. So sometimes taking those culprits to court is also a problem. And also the time that we're going to be spent in and out is also another issue that is also causing this delay in some of these processes, especially when you take somebody to court. And sometimes this Muslaha syndrome of being connected to the individual. We all know that Gambia is a very small country, and we are all connected. So these are some of the issues that we face in the community that are hindering the implementation of this Tobacco Control Act and the regulation. Compliance to public smoking. Previously, we can see it was going down. But now with the introduction of these new tobacco products, we have seen an increase. And sale of single stick, as highlighted by CFO, this is completely banned, and we have seen it. So this make it so easy for people to get access to tobacco products, especially the illegal means of tobacco products that come through the porous borders under these CISA. Everywhere you go to, any restaurant you go to, they have CISA services. And most of these restaurants, without CISA services, youth don't go there. So it is forcing those people to introduce CISA service to their restaurant services so that people can go there. They can also have some clients, and then they can also have at least both of their resources. So this is why we are seeing a little bit increase of public smoking in the country. And people take it as carefree attitude. And the enforcement, as I said earlier on, is difficult. Honestly, is completely difficult, because we see the people that are responsible, they are thin on the ground, and sometimes it is difficult. And even here at the Ministry of Health, sometimes it is difficult. You see your bosses been violating the rules, and the police, the top brass smoking, and the other ministries to the top brass smoking. It will be very difficult. It's sometimes very difficult to address those people if you senior people are not adhering to the laws. It's completely difficult. So these are the challenges that we have, and collectively, if we put hands together, at least we can overcome some of these challenges by sensitizing people on the dangers associated with these, and show them the better way of doing things to maintain healthier life. Because when you look at tobacco product, it doesn't mean that when you just smoke and that the smoke goes out, that's all. But the one next to you, when the person inhales this smoke, it means that the person is smoking just like you who is doing the act. This is passive smoking. And even if you suppose we use here as a smoking zone, is also the same, because the particles will be here. So whoever is here to clean this will also be exposed to those dangerous chemicals, and it can also harm the person equally as it is harming you, the active smoker, because the same chemical composition will be in there. So if we sensitize the people and the people know all the dangers associated, I think it will go a long way in improving the health of the people and informing them of those dangers, and that this can stem down the prevalence of tobacco use in the country. So it's a collective responsibility, per se.
Thank you, Mr. Baji, for responding.
Part and the Kanifi municipality. And altogether, we have about 156 violations of the different provisions of the Act, from open park selling to illicit tobacco products, that is SAR. We especially have a challenge with SAR because this has been going on, it has been smuggled for over a year, and we tried to get to the culprit from Basse. We were told by the custom officers that they also conducted a joint operation with the customs in Senegal to apprehend the guy, because it is Gambia and Senegal that the product is coming illegally, because the product is made in Guinea. If you look at the pack, it is made in Guinea, and they smuggle it to Senegal to the Gambia. So they conducted an operation, a joint exercise there in the early part of the year, around January, February. They said they got the guy, but still the product is coming, because we even in Combo here, you go to most of the shopkeepers, they have at least a gross or half gross with them. So 156 apprehensions were made, or confiscations, violations of the different sections of the Act were made, and not all of these were taken to the police station for cautioning, but some of them that, for example, those that we found the illicit tobacco products with, and those that have the electronic cigarettes, all these people were taken to the nearest police stations for cautioning, and the products were confiscated, the confiscation forms were filled. In terms of court processing, like my boss said, this is following due processes, and for now nobody is arraigned before the courts, but the processes are ongoing, and with time we hope we will also get to that level. But for now we have about 156 apprehensions for this quarter only. Thank you. Yes.
Yeah.
All right.
Yes, you rightly stated. You've not
Engage them in dialogue, make them understand, and because this is money. A gross will now cost you around 1,000 or so. So if you take this from somebody, 1, 2, 3 occasions, the person is going to learn a lesson and will willingly stop taking these products. So that is the measure we are going to take. We will get to that level, but for now we don't want to use that excessive force.
Yeah, just to add on it, approach. And as Sefo rightly said, we don't want to use any force. We just want to be with those people, culprit, sensitize them so that they can at least adhere to our rules and regulation with regards to Tobacco Control Act. But it doesn't mean that there is nothing that has happened in terms of legal action on tobacco control. Not from the side of the Minister, but GRA once took some culprits to court and that they were heavily fined and that they paid all those fines. So very soon we'll also follow the footstep. But right now we are just using the health diplomacy. But it seems that things are going out of hand and we'll also follow suit very soon. Thank you very much. We don't want to tamper with it because we have the best one so far. And it includes, what makes it the best among the lot is we don't have any designated smoking area in this country. And all the fines have been adjusted. Previously, we don't have those ones, and the fines we have is very small, like $100, $50 is very small. But now we are talking of thousands. If you are found wanting, is thousands you have to pay, depending on the particular violation that you have conducted. So ours is very good. So I think we can maintain it for a while, and let's see what is going to happen. What we need now is behavior change and a series of sensitization for behavior change. That's what we are looking forward to, and we need your cooperation, we need your support in that regards.